I did. على
Okay,
الفاتح.
so the scenario is a 66-year-old man present with gradually onset bilateral calf pain that worsen with activity. You are a surgical SHO. You have 6 minutes to take a focus history. Let me put the timer. Okay, 6 minutes started.
Good afternoon.
Good afternoon.
I'm Dr. Fathar Rahman, one of the surgical doctor. May I confirm your name and age, please?
I'm Mr. John. My age, I'm 66 years old.
Nice to meet you, Mr. John. How can I help you today?
I have swelling. I have pain on my calf, both leg.
Sorry to hear that. So I will ask you some questions regarding your condition. Are you okay with that?
Yes.
Could you please tell me more about this pain?
Yeah, I feel this is pain. It start gradually, and now I have 1 year suffering from this pain.
You started 1 year. How many years, if you remember?
1 year.
1 year. So start gradually.
Yes.
Okay. How this pain is now? Is it improving or worsening now?
It's worsening.
Anything make it worse?
Yes, rest. No, the activity make it worse.
How far you can go without starting this pain?
I used to walk 5 block. Now I walk only 1 block.
Sorry to hear that. That may be hard for you. Is this pain in both legs or only one leg?
Both leg.
Both legs. Do you have any swelling?
No.
No. Is this pain? Did you feel this pain during rest or sleeping?
No.
Okay. Is there a skin change or ulcer?
No.
No. Do you have any legs weakness?
No.
Any history of back trauma?
No.
Okay. Do you have any chronic illness?
Yes. I have diabetes.
What medication you are taking for diabetes?
I'm taking insulin.
Any other illness, heart problem or anything?
Yes, I have hypertension also.
For how long you have hypertension?
10 years.
What's the medication you are taking for hypertension?
I take amlodipine 5 mg.
Okay. Do you have any allergy for any medication?
No.
Okay. If you don't mind, I will ask you some personal social question.
Not at all.
Mr. John, what is your job?
I'm retired now.
Okay. Any family history of similar condition?
Yes.
Do you have this symptom before?
No.
Okay. Who is living with you at home?
My wife and my 2 children.
Okay. Mr. John, do you are smoking?
Yes.
Do you have how many packets per day and for how long?
20 cigarettes per day for 20 years.
Okay. Do you drink alcohol?
No.
Okay. Mr. John, can I know what's the idea about your condition?
I have no idea. That's why I come seeking for medical advice.
No worry. We'll do our best to help you. What's the most concern?
I'm afraid to not walking again.
No worry. We'll do our best and we'll help you. Mr. John, do you have a... Hello?
Yes, again?
Do you have a headache?
No.
Any chest pain?
No.
No. Are you feeling your heartbeat?
No.
Do you have tummy pain or digestive issue?
No.
Are you experiencing any problem with water work?
No.
Do you have joint pain?
No.
Mr. John, thank you. I'm appreciating cooperation. I will discuss your issue by consultant and feed you back shortly. Thank you.
You have 1 minute. You'd like to ask anything, or should we start the discussion?
I think we can start discussion.
Okay. Could you please present your case?
I took a clinical history for Mr. John, who is 65 years old. He's known case of hypertension and diabetes with good control. He present with bilateral calf pain for 1 year, which has become more and more increasing with walking, by relieving by rest. No symptom and sign suggestive of acute or critical limb ischemia or spinal issues. He's a heavy smoker and he's drinking alcohol occasionally.
So what's your main differential diagnosis?
My main differential diagnosis is chronic limb ischemia.
What are other differential diagnoses?
Others are critical limb ischemia and spinal claudication or spinal stenosis.
Okay, and how to approach this patient?
I will start with the full clinical vascular and neurological examination. Then I will order some blood tests in form full blood count, inflammatory markers. I will do clotting profile, renal function test, liver function test.
Okay, and continue.
I will order duplex arterial ultrasound for both lower limb. I'm not sure if you need CT or MRI angiogram.
Okay, and what's your treatment plan?
I will start with discussing the patient with a multidisciplinary meeting. Then I will conservative management to improve exercise, lifestyle modification, some analgesic. I will order statin or anti-platelet medication. Intervention, I will consider angioplasty plus or minus stent, bypass surgery, more interventional surgery for complication like ulcer and gangrene. I will consider amputation if non-salvageable limbs.
This is the last question. This session you have 40 seconds remaining. So Al-Fatih, Fatah Ar-Rahman, excellent presentation. Let us review from the beginning. Ali, I will start, okay? So Al-Fatih, you introduce yourself, you took permission, but why you didn't offer painkiller? So
because
if you,
it's not, I don't know. It is not intentionally, but I forgot it.
Yeah. If you mention it, it will be very fine and can increase your mark of professionalism. And you forgot to ask about description of the pain. Is it crampy, dull?
Yes.
Yeah, and radiation. And you exclude most important differential diagnosis. You start by the first differential diagnosis and the spinal and the critical, but you showed a little bit of disorganization between social and past and family history.
Yes.
Yes. You start by social, then you jump to family and past. It will not affect you critically, but if you organize it will be better. Social history, everything you asked about. I'm so happy that you asked about the eyes, idea, and concern and expectation. Regarding discussion, you have 4 marks out of 4. You completely master the discussion. I have no anything regarding your performance. Very nice. Ali, you can start.
Yes, Muhammad, I was muted. But Rahman, that's a big improvement. I think you are doing pretty great. There are small mistakes What are you smoking? I think you said instead of do you smoke, and you just need to say, do you mind if I ask you personal questions? Don't complicate it. Just say, do you mind if I ask you personal questions? Your patient name, I think you mentioned it around 4 times. You can just mention it more than that.
Good.
Just keep mentioning your patient name. You can smile during the exam. That should be fine. But I don't have much of the point. I think you're going to pass this station.
Thank you. Thank you.
Okay, so we will move to the next station. 20 يوم 22. طيب. So the next station is pre-operative hip pain assessment. I think this is the most common station recently. Who will
Yes.
take this station?
Let me take it.
Okay, I will take it.
Okay, no problem.
Al-Fatih and Ahmed. Who
Okay.
practiced recently
خليتنا نشتغل المرة اللي فاتت تقريبا. مش
by
ما
time?
مشكلة.
Here we can pair it by time.
طيب خدها يا أحمد. أحمد خدها.
Okay. So Ahmed, are you ready?
Yes. Just a second.
Okay.
But I cannot open the camera. Unfortunately.
It's okay. Just don't follow
Are you
school.
Ahmed,
No,
are you in the disco?
I am the mosque
Very
Okay,
nice.
okay.
So
Mohammed.
the scenario
in the
is
middle.
is an elderly man presents for surgical assessment prior to right hip replacement. You have 6 minutes to take focus history and 3 minutes for discussion. Okay. Who will be
So
the patient for
Al-Fatih,
the
Okay.
Al-Fatih, I want you to be very talkative patient. Bring topic that has no relation to the station. Speak about your granddad. Speak about your children. That's how the station will go. Okay.
Yeah, again, please. Okay.
Just bring topic that has no relation to what he asks about.
and be
Not
Okay.
speak about your life. Be very talkative.
Okay.
A good
Okay.
point. Because most of the candidates are complaining of the boring candidates.
Yeah. Yeah. This I had this station on my exam. The patient was very talkative. Okay, let's
Okay.
start.
Okay, so Ahmed, 6 minutes started.
Okay, hello. I am Dr. Ahmed Sougi. I'm a surgical doctor working here. Can I confirm your name and age, please?
My name is Steven. I'm 70 years old.
Oh, nice to meet you, Mr. Steven.
Uh,
I understand that you are here for your surgical. I will ask you some questions to know about our health of you. Is that okay with you?
yeah, no problem. Go ahead, doctor.
Okay. Mr. Steven, can you tell me what can you tell me how this can affect your life generally?
Yeah, I feel very boring and
Mhm.
nothing to do because of this pain
Oh, I am
in
really sorry
my
to hear
hip.
that. Oh, I am really sorry to hear that, Steven. That must be frustrating for you.
Yeah.
Okay. Do you want me to prescribe you a painkiller?
No, it is because it is now
Mm.
more than five years.
Oh,
I did all take my many types of painkiller.
oh,
You can imagine that. I
oh,
tried to
that's
do.
frustrating.
I try to take different
Mm.
type of painkiller, but
I'm
now
sorry.
I think I'm okay.
Oh, I'm sorry for that, Mr. Steven. That's frustrating. Okay, Mr. Steven. Can you tell me how far you go before how far you go without stopping?
I used to go anywhere, even for 5 blocks before, but now
But
I can't. Do even 2 blocks. I can't do shopping by myself. I can't practice exercise, and I can't go to the gym. I'm just sitting at home with my wife, and even my kids is out of my home village. I can't
So that
I can't go to visit them. They used to visit me occasionally, which is very bad situation now. It is awful.
that's frustrating, Mr. Steven. I understand you. Okay, Mr. Steven. Can you tell me, do you diagnose by any cardiovascular disease?
Oh, yes. I have many time I have a recurrent MI. I don't know I don't know why I survived from last one, because the doctor told me it is I came just in the suitable time, because it was a complete block.
Oh, I am sorry for that, Mr. Steven. Okay, Mr. Steven. Do you take any medication for your cardiovascular disease?
Uh, Actually, 2 years ago, I underwent open heart surgery. I don't know what has happened during surgery, but I'm taking blood, which is called, I think, warfarin.
Mhm.
This
Okay.
is this is related to my heart problem. I'm taking warfarin now.
Okay. Okay, Mr. Steven. Can you tell me what's the dose?
I don't remember. I think 5 milligram.
Okay. Mr. Steven, do you have any chest pain?
Chest pain? No,
Okay. Any shortness of breath?
no.
Okay. Do you have asthma?
Yes, doctor. I have an asthma, and I'm taking inhaler. Yeah, I'm
Oh,
taking inhaler.
okay. Okay, Mr. Steven. Asthma for how long?
Oh, it is uh, since I was 10 years, maybe.
Oh, okay, Mr. Steven. Mr. Steven, uh, do you have any lower leg swelling?
No.
Okay. Do you have any, do you diagnose before by diabetes?
Yes, I have diabetes, but I'm okay with medication.
Okay, what medication do you use?
I used metformin.
Metformin, okay. What is the dose of it?
500 milligram twice a day.
Okay. Uh, do you do you do you take any surgery rather than your heart surgery?
No, it's only heart surgery.
Okay. Uh, how about anesthesia complication? Do you experience anesthesia complication while the surgery?
I don't know, because last time I'm not aware. I'm sleeping during surgery, but anesthetist didn't tell me that I have any complication or something like that. But I don't know what has happened at that time.
Okay. Do you have any allergic complication?
No, I don't think so.
Time up. Could
Okay.
you please present your case?
Okay, I'm present Mr. Steven, which came for operation total hip replacement, has multiple comorbidity, has previous cardiovascular disease, high, and has MI, and has an asthma, and since 10 years, since he was 10 years old, and no surgical, no anesthesia complication, noted.
Okay. And is this patient taking any warfarin or blood thinner medication?
Yes, you take warfarin 5 milligram, 5 milligram.
So is the patient fit for surgery today?
No, patient has multiple comorbidities that make no that make the patient not fit for surgery and want further anesthetic
Why?
workup, and he is want further anesthetic workup, and
What else?
warfarin many.
Okay. And what is the recommended preoperative workup?
Okay, I will do full history from this patient and full examination. Then I will request blood test like CBC, complete blood count, urine electrolyte, and LFT with enzymes, and I will request ECG, chest X-ray, echocardiography, and monitoring.
And who you would like to call to help you assess this patient?
I would like to call cardiologist, chest physician, and hematologist, and orthopedic surgeon, and anesthesia, and anesthetist,
Okay. Can COPD
and endocrinologist.
okay. Can COPD and asthma coexist?
Yes, which is called asthma COPD overlap syndrome.
Okay. Thank you, Ahmed. You can go to the next station. You have 20 minutes. I think this is the last question in this session.
20 seconds.
Yes, 20 seconds. You'd like to start, Ali?
No, Muhammad, you start.
Okay. Very nice presentation, Ahmed. This is a being very common session recently, and you manage it well. So let us review from the beginning. Just introduce yourself, took permission, and you start asking about the pain immediately. Could you tell me this pain affect how this pain affect your daily life? And this is a very nice beginning. You ask about the most comorbidities: asthma, COPD, hypertension, diabetes. I'm so glad, Ahmed, that when you asking about the condition, you immediately ask about the medication. Perfect. So you cannot miss any condition without knowing if this patient taking any medication. I know the time didn't allow you to ask about the other medication, which include warfarin. Yes.
This patient was talkative.
الفاضل ضحكنا معاك.
Yes.
ما شكله طبقت الدور كويس مش يا علي؟
Fatih very Yes, but the point, Ahmed, you should interrupt your patient. When your patient is so talkative, you should ask open and end question. Don't ask, tell me about. No. What is, were you diagnosed by hypertension? Make the patient say no or yes. Were you diagnosed by COPD? Like that. Don't tell me, asking by tell me or thing like that. But because this patient will use it to talk more about this condition. Otherwise, regarding the discussion, you should mention this patient come or this patient undergoing a right hip replacement for osteoarthritis. You skip this point. You said the patient has multiple comorbidity.
Yes.
Otherwise, you must at the station have no any point. Ali, you can start with Ahmed. Hello. Very nice presentation, Ahmed. I have no any
Muhammad,
point.
I can hear you, by the way. I was just muted. Fine. Ahmed, this station, you performed in a good way. So this station, what will happen, you will go to the exam and the patient will be very, very talkative. Al-Fatih, he's been talkative now, but he's going to be more than Al-Fatih. He's going to be very talkative. I remember I was not able to ask anything. This station is especially common in Gulf area, in Emirat, Dubai, and in Oman, Bahrain. The patient will be speaking about himself all day long. I've done this, I did that, I've done this, I've did that. No, doctor, let me tell you about my grandson. He's very annoying. Can you imagine? So the patient will be very talkative. I think you managed in a good way. There was not a lot of grammar mistakes. that you just need to repeat the presentation. You have to present it in a better way. You have to be fast in your presentation, knowing exactly what you're gonna say. But I don't have any other comment. You just need to remember the presentation we wrote in the school and say it like 3-4 times so you can say it fast. Okay?
Just I want to ask a question.
Yeah.
When this patient talk a lot, I cannot interrupt him.
No.
And,
Look. You come with the intention that you don't know if the patient is talkative or no. Okay? For the first 1 minute or 2 minutes, you don't interrupt. And then you will learn that the patient is very talkative. When you learn the patient is very talkative, the consultant wants you to ask open and close question in this case. Okay? So you will come with the intention that you want to understand what's going on. When you find your patient is very, very talkative and he's giving you information you don't need, and let's say you ask him, do you have any cardiovascular problem? And he said, oh, doctor, last week I had this tummy pain and I have gastroenteritis. They gave me proton pump inhibitors. I think they call it omeprazole. It did help a lot. At that moment, you say, Mr. John, please, in yes or no, did you have cardiovascular problem? So
in yes or no, in your mind, Ahmed, you okay?
أيوة.
Yeah.
طيب.
Okay. So, Ali, should we move to the next station?
yes, let's move to the next.
Okay, the next station is impotence. Who will take this station?
Okay.
Okay,
Take
Fatih.
it. I can take it. Okay, Fatih.
Ala, you can take the next station. Ala, Al-Fatih. Let's Al-Fatih take this station and Ala the next one.
But Rahman, can you be the patient?
Yes, no problem.
Okay. So the scenario is a 32 years old man presents with difficulty initiation and maintaining an erection. You have 6 minutes to take focus history and 3 minutes for discussion. All right.
Okay. Again, please, السيناريو تاني.
32 years old man presents
Okay.
with difficulty initiating and maintaining an erection.
Okay.
You have 6 minutes to take a focus history, 3 minutes for discussion. Okay. 6 minutes started.
Hello, I'm Dr. Al-Fatih Ahmed, one of the surgical doctor here. May I confirm your name and age, please?
My name is Smith. I am 34 years old.
Nice to meet you, Mr. Smith. Mr. Smith, today I'm going to be your doctor. Is that okay?
Okay, go ahead.
So, Mr. Smith, how can I help you today?
Doctor, I facing that I have difficulty with erection.
Oh, I'm so sorry to hear that, Mr. Smith. But before to go further, I want to offer to you a Caberon if you don't mind, or you are
Yes.
okay with that.
Yes, please.
Also, I want to assure you all your information you should share. It will be very confidential. Okay?
Okay.
Okay. So tell me more about this problem.
I noticed it about 4 or 5 months ago. That gradually, but now it is more worsening and more worrying me.
I'm so sorry for that. It is started 5 months ago. At the beginning, can you? I want to ask you: do you have a partner?
Yes, I'm married.
Yes. Okay. Fine. Do you have children?
I have 3 kids.
Oh, very nice. So, Mr. Smith, do you satisfy during the relation?
Honestly, last couple of months, I'm not feeling good with erection. We start intercourse. So I don't feel that I'm satisfied.
Okay. And what about your partner? She's satisfied or not?
I think this is the most important part, depressing.
Yeah. I appreciate that.
He's not happy about sexual activities.
Would you tell me when the last intercourse happened?
It's almost 4 or 5 months back.
5 months. Okay. Do you is the erection is it enough good enough to penetrate?
Now, last months it is very difficult to initiate erection.
Even you can't initiate it.
Yes.
Okay. So, Mr. Smith, do you have any? Do you notice any sleeping disturbance?
Yes, I'm experiencing difficulties to start sleeping. Walk multiple time at the night.
Do you facing any difficulty in your work?
Yes, it is very hard for work.
What is your job? If I ask you personal question, what is this job? What is your job?
I'm an accountant.
Accountant. Yeah, it must be you are facing very stress a moment, right?
Yes.
Yeah. And do you have any history of psychiatric disorder before?
Yes, I have been diagnosed with depression a couple of months back.
Do you have any session for treatment, psychological treatment or psychotherapy?
Yes, I underwent counseling a couple of times, but I think no noticeable improvement.
Okay, sir. So, do you have diagnosed with any chronic medication before?
Yes, I'm hypertensive.
What are you taking for high blood pressure?
I think it is atenolol or something like that.
Do you know your dose?
I'm not remembering exactly.
Okay. Do you have any history of similar condition before, or this is the first time for the last 5 months? Do you have experienced any problem before?
This is the first time to experience this.
Okay. Do you have diabetes?
No.
I would like to ask you further personal question. Is that okay?
Okay, sure. Go ahead.
Do you smoke?
Yes, I'm a smoker.
How many cigarettes per day?
I can say 2 buckets per day.
Yeah, okay. Do you drink alcohol?
No, occasionally only.
Okay. And in your family history, do you know any one of your family member suffering this problem?
You know, this is some frustrating.
I know. No worry. I would like to ask you some quick question, yes or no, okay?
Sure.
Okay. Do you have chest pain?
No.
Do you experience heart beating?
No.
Any shortness of breath?
Oh, no, sometimes.
Okay. Do you feel any
Time
abdominal
up.
pain?
Could you please present your case?
I took a clinical history from Mr. Smith, 34 years old, complain of difficulty initiating erection for last 5 months. Mr. Smith is no case of psychiatric disorder with history of counseling, but it is not helpful. Also, Mr. Smith has sleeping disturbance and in difficulty to start sleeping and early waking. Also, Mr. Smith is hypertensive, taking atenolol. So, also, I want to add Mr. Smith is facing stress condition in his work. So my diagnosis is erectile dysfunction related to stress. Also, I would consider erectile dysfunction related to antihypertensive agent.
So what's your investigation?
My investigation first, I would like to do a full blood count and CBC, RFT, LFT, thyroid function test, and also I would do inflammatory marker and lipid profile, hormonal assay like testosterone, and also I will do ultrasound, duplex ultrasound for to exclude vascular disease. Also, I will do nothing else.
Okay. And what's your treatment?
I will start treatment by conservative treatment, reassure the patient. I will give him sildenafil, and also I will encourage to change his mode, uh, to change his lifestyle by do regular physical exercise, and also I will change the antihypertensive atenolol to another drug after comes after talk with physician, and if not improved, I will consider prosthesis implant.
This is the last question in this station. Very nice presentation, Al-Fatih. You have 14 seconds. So let's review from the beginning. Very nice presentation, Al-Fatih. I have no couple points. I think 5 or 4. I'm so glad that you start by offering a chaperone. In this, I am so glad that you offer a chaperone for this session because it's mandatory, and you start and you told your patient this is confidential information. Very nice beginning, and you analyze your main compliant. But Al-Fatih, you know this station, we divide it into sexual history, psychiatric history, and other principle of the history like past, family, drug, and so on. So you missed 3 questions in the sexual history. You didn't ask about the ejaculation. Is there any premature ejaculation? You missed to ask about the morning erection or nocturnal erection.
Yes.
And you missed to ask about the libido. This is a crucial and important question, Fatih. I know you asked all the questions, but you should ask about this. So I make this station easy. How I make this station easy? Imagine we are a man. So when we woke up, we have a desire.
Yes.
Then we have a morning erection.
Yes.
Then you should ask, but do you have a partner? Is partner satisfied by the relationship? Then go smoothly. Is there any premature ejaculation and so on? Take it as the story.
Yes.
And so regarding you ask all question, mood, sleep, very nice. But Al-Fatih, what's your main differential diagnosis?
My main differential is psychological, is erectile dysfunction related to his stress condition.
He said he faced stress.
Yes.
A lot of stress.
Yes.
Yeah.
And with with mood sleep disturbance.
Yes. And then atenolol. And when I ask you about the investigation, why you didn't mention the examination?
You said investigation. You didn't. You did.
Investigations.
You said,
investigation mean examination also, Al-Fatih. When the examiner asks you how to approach this patient, how to manage this patient, how to investigate this patient. If the investigation didn't mean examination, you should say examination. I will start by doing full examination, then I will request.
اوكي. انا بس لخبطت يا محمد لانه المره اللي فاتت اظن في اخر مره قلنا لما نحصل انفستيجيشن جو فور لما يزال مانجمنت جو فور كلينيكال اورجانيزيشن او انفستيجيشن مش في شنو انا لخبطت معاه.
لا يلا احنا قلنا كده ايوه صح. بس يا الفاتح انت لما مثلا
محمد اتكلم بالانجليزي يا محمد.
when the examiner start to ask you at the beginning what's your investigation, skip
I have
the
to say?
investigation and say first, I would like to do full clinical examination. Then I will
Okay.
request. Will be
Okay.
better.
Okay.
Otherwise, you must at the station, you answered all the non-invasive management and invasive therapy, but say lifestyle modification before the medication. Otherwise, you have no
Okay.
point. Very nice presentation.
Yes, welcome, Hassan. Good morning.
Ali,
I
continue.
just want to add 2 points quickly for Al-Fadi.
Mhm.
In your differential diagnosis, is either either stress-induced impotence or the erectile dysfunction, or beta blocker induced erectile dysfunction. You said hypotensive agent. Hypotensive agent is not a wrong answer, but it's not accurate. Amlodipine will not give you erectile dysfunction. It's beta blocker, specifically here in this case atenolol. So in your main differential, say beta blocker induced erectile dysfunction instead of hypotensive induced erectile dysfunction.
Okay.
Because
And I think I wanted to say antihypertensive agent, not
even
hypertensive.
if you said antihypertensive agent, it's not an accurate answer.
Okay. Atenolol. Okay.
Thiazide, furosemide, amlodipine, ARBs, lisinopril, all of them are hypotensive, but they don't cause any erectile dysfunction.
Okay. Atenolol. I have to say
Atenolol, yeah,
atenolol.
atenolol induced
Yes.
or beta blocker. Okay.
Okay.
Muhammad, for whatever reason, I have a call. If I got cut, just bring me back. Your presentation is right. There's a small discussion between you and Muhammad about this station.
Mhm.
So it really depends about your patient presentation. If your patient came, if he had social history for a long time and he had no erectile problem, and then he started to take the drug, and then he developed the impotence. In this case, it will be atenolol-induced erectile dysfunction.
Mm.
If your patient had hypertension for a long time and he's taking atenolol for a long time and no problem, and now because due to the stress in the work, he has a social problem, then that means it's going to be a social problem. But what will happen on your exam?
Mhm.
It will be a beta blocker one. Your patient may say, I don't have stress, or your patient may say, so just prepare yourself more to the atenolol one, okay?
Okay.
That's all what I want to say. But otherwise, you're going to pass this station. You perform perfectly.
Thank you very
We
much.
have the last 2 stations, which will be taken by Ala and Hassan. So let's move to the next, Muhammad.
So let me open school.
Depression, the next station.
Yes.
Depression. Hassan and Ala, you're gonna, all the rest of the people are practice today. So it's going for the first station. Hassan, if you can be the patient for Ala
Ali?
for the depression. Yes, Muhammad.
Yeah. Hassan, patient for Ala, yeah.
And then the next one, Ala will be the patient for Hassan. Let's start.
Okay. Ala, the scenario is a 45 years old male underwent gastrectomy 3 days ago and is now showing signs of low mood. You have 6 minutes to take focused history and 3 minutes for discussion. Hassan, hello, Hassan. I think Hassan.
Yes.
Okay. So can you be the patient?
اوكي
اصلا صاحي من النوم ولا شنو؟ شكلك كنت شغال
هاي
نايم.
والله Yes, I was night.
Okay.
Okay, let's start.
So 6 minutes started.
Hello, Dr. Ala, one of the surgical doctor here. May I confirm your name and age?
Yes, I'm Mr. John. I'm 55 years old.
Nice to meet you, Mr. John.
Nice to meet you, doctor.
I will be your doctor for today, and I will ask you a few questions.
Yeah, go ahead.
Is that okay with you? Okay.
Yes, doctor.
How have you been feeling recently?
Yes, I'm feeling not good. Doctor.
Would like to talk more about it?
Yes, doctor. Just after I come here to this hospital, I just really feel more tired than usual.
Oh,
And I
I'm really
feel not enjoying anymore.
Oh, I'm really sorry for that, Mr. John. Can you tell me, during the hospital, during the stay at hospital, the past a few days, have you felt like you are feeling depressed and low, hopeless?
Yes, doctor.
Oh, okay, I see. Have you noticed that recently you lost the interest and joy in life?
Yes, I said you, doctor. I just lost all my. I lost. I'm not enjoying anymore.
Yeah, I see. I'm really sorry for that. Okay. Have you do you have any do you feel tired through all the day?
Yes, doctor.
I see. Is there any difficulty with the sleeping, Mr. John?
Yes, doctor.
I see. If there's any, do you notice any change in your libido?
Yes, I think it's now more or less
Yes. So,
than before.
So, Mr. John, do you notice any change in your appetite?
Yes, doctor. I think it's also low.
Yeah, I see. Are there any particular time of the day your mood become more worse?
I think from we start in the morning, more become more worse.
Mhm.
Then become good with time.
Okay, I see. I understand. So, Mr. John, have you had similar condition? Have you ever had been similar symptom before, or similar condition before?
Yes, doctor.
Okay, I see. Have you been okay, Mr. John, have you had diagnosed with depression before?
No, doctor.
I see. Okay. Have you been admitted for mental health issue? For mental health issue?
No, doctor.
Okay. Have you expressed any problem? Have you been expressed any mental health issue?
No, doctor.
I see. Okay. Uh, mm, do you feel? Do you seeking for counseling or medical advice?
Yes, I think I went to my GP the last episode, and he told me we need to more he need more assessment for this problem. But I didn't go again to my GP, so I am here now.
Okay, I see. Okay. Uh, Thank you, Mr. John.
Thank you, doctor.
I will discuss with my senior and I will update you.
You have 1 minute
Okay.
and 10 seconds. Do you like to ask anything, or should we go to the discussion?
Go to discussion.
Okay. So could you please present your case?
Okay, I'm presenting Mr. John, 44 years old, post gastrectomy, day 3, showing history showing symptom of major disc, major disruptive,
Depressive disorder, yeah.
major depressive disorder. He has lost he has anhedonia and lost a lack of interesting life, enjoy life, and he has diagnosed before with depression, and see medical advice. See medical advice.
Okay.
My differential diagnosis is major depressive disorder.
Okay. And what's your investigation for this patient?
I will start by clinical examination to assess any other medical causes or condition, and then I will request for CBC, panel comprehensive electrolyte, vitamin B12 and folate measurement, thyroid function test, CT and MRI.
Okay. And what's your treatment?
I will discuss with psychiatry, primary team and psychologist. Start by conservative management. Regulate, encourage for exercise and sleep hygiene. I will start also physical pharmacological management, selective serotonin reuptake inhibitor, and psychological support. Immediate low intensity depressive for mild cases, and high intensity for moderate and severe cases. And last thing, risk intervention or risk management. Immediate intervention if the patient have idea of suicidal or self harm.
Yeah. This is the last question in this station. Very nice presentation, Ala. And let us review it from the end. You mentioned now if you have any, you mentioned now the risk management of suicide, and you didn't ask your patient about it.
Yes, exactly.
So Ala, asking your patient, do you feel like harming himself or anyone is a crucial question here. Okay, so let's review from the beginning. You introduce yourself, you took the permission. We didn't ask about the patient name and age. Very nice. And
No, she asked Muhammad. She asked.
Name and age?
Yes, she said, what's your name and what's your age? That I put in one of my notes.
Yeah, so asking patient about name and age here, Ala, it is not ideally because the patient name and age already written, and they ask you don't mention the patient, asking the patient name and age.
So in the scenario outside, they will tell you not to ask about the patient name and age because the patient is already depressed. He has no mood to speak to you. I think Hassan is just being nice, but the patient will say we will find it difficult to extract any word from the patient. That's why in the scenario outside, before you get into the history station, they will tell you don't ask the patient name or age. Yes. You will know the patient name and age from outside. You will get inside and you will already know the patient. Hi, Mr. John, how are you? How are you feeling today? That's how your station will start. Continue, Muhammad.
Yeah, Ala, this station we have main principle. First thing, the sleep. You ask your patient, could you tell me more about your sleep? If the patient said, no, I have a problem with my sleep, specify your question. Did you find yourself difficult to walk in the morning and get sleep at the end? Okay. And the second principle is the mood. You ask it very nice, but you forget to ask about this appetite. Am I clear?
Yes.
You should ask about the appetite.
So Muhammad, let me just add one thing here before you finish. So for the major depressive disorder, the criteria to diagnose major depressive disorder is written in a mnemonic called SICK caps. I just updated it to the school. If any one of you are refreshed now, if you can refresh, you will find it at the bottom of the station. It has 7 or 8 letters. SICK caps. S for sleep, I for interest. So how is your sleep? How your interest in life? When you ask about the interest of life, you will know that the patient has anhedonia. Guilt, do you feel any guilty? It's not very important to ask about it. That's why we didn't put it in the school. E, energy, how is your energy? C, concentration. A, appetite. B, psychomotor problems. And S, suicide. So I want you to remember this 1, 2, 3, 4, 8 symptoms for major depressive disorder. It's very important. If you found 3 of these, that means the patient has major depressive disorder. Do you see the picture on the bottom, everyone?
Yes, it is there. It is there.
Yeah, continue, Muhammad.
Yeah, I have the last point regarding discussion, Ala. When the examiner asks you how to present your case, just mention the sleep. You didn't talk about the sleep and libido. You just said this patient has a sign of major depressive disorder. Mention 2 or 3 points regarding sleep and libido. Otherwise, you answered all questions regarding investigation. You start by full clinical examination. It's a very nice thing. And you mentioned the lifestyle modification in your treatment. It's a very important point. Very nice. I have no anything to add. Thanks. Ali?
Okay, so I will just correct some of the sentences you said. You can say, in your presentation, you said this patient had depression and his own counseling. Or did you seek counseling? I think I don't remember exactly what did you say, but you can say to clinical history from this gentleman who has symptoms of major depressive disorder, including loss of appetite, anhedonia, loss of energy, sleep disturbance. He also didn't see he was diagnosed with depression on counseling. So depression on counseling will save you time instead of saying depression and then he was counseled or he sought counseling before. You said conservative management. When we say conservative management, we're basically saying the patient has no surgical treatment. So the term conservative management is not correct here. The term you should say lifestyle modification, psychological support, pharmacological therapy, and risk management for the suicide. So don't say conservative management. When you say conservative management, that means you are not intervening, you are not doing something surgically. Okay? Yes. Just say lifestyle modification. I think that's most of my point. But overall, you're gonna pass this station. That's a very good presentation. It's a very difficult one. Just remember the 8 letters in SIG-E caps that's in the image in the last image in the school. If you forgot anything and you just ask about these 8, you will pass. Just make sure you don't ask about the patient name. If they said outside, they gave you the patient name. And when you come inside, you just ask about this and then psychiatric history. Okay?
Okay. We have the last station in the history, which is dementia. Hassan? Hello. Can you take this station?
Wallahi, I didn't prepare for this station.
You can take it without preparation. Ali, I think Ali, he wanted to talk.
Wallahi, I don't know anything about this station.
Look, dementia. You come inside the room. You don't ask about the patient name. You introduce yourself first. Hello, my name is Hassan. I'm one of the doctors working here. Just bear with me 1 second.
Don't ask about past medical history, drug history, family history, eyes, or systemic review. Just abbreviated mental score. Patient name, patient age, patient date of birth, place, count from 20 to 10, like that.
I think there is criteria, but I cannot remember.
Look, okay. I just received an email, that's why. Okay, so get inside the room, Hassan. Ask about, introduce yourself and take permission. And then immediately you ask about time, person, place, what is the year, who is the king or the prime minister. And then ask about countdown from 19.
Street.
Yes. So imagine yourself, you went to the exam and nobody told you about it.
Okay. So let me put the 6 minute Hassan. Who will be the patient? I think Al-Fatih or Ala. One of them.
No problem. Let me be.
Okay. So 6 minutes as a scenario, Hassan. Let me read the scenario.
Okay.
A male patient found confused on the ward. You have 6 minutes to take focus history and 3 minutes for discussion. The patient called Mr. Jack. Okay.
Okay.
So 6 minutes started.
Hello, Dr. Hassan. I'm one of the surgical doctor. Nice to meet you, Mr. Jack. Nice to meet you again. Uh, I'm, uh, I understand you. I understand you are feeling some confused, or you are confused now. Just so I want to ask you some question, if you don't mind.
Okay, doctor, no problem.
Okay, could you tell me what's the time now?
I think it is early morning.
Okay, and can you specify at which time?
I think
Can
morning,
you?
but I don't know.
Okay, and could you tell me where you are now?
Yes, I'm in the hospital.
Okay, what's the name of the hospital?
I don't know.
Okay, and could you tell me date of your birth?
Yes, 27th February 1946.
Okay, 1946.
Yes.
Am I right?
Yes.
Okay, so Mr. Jack, I want you to ask you if you can count from 1 to 20, from down to up.
1, 2, 3, 4, 5, 6, 7.
Okay, okay, I see. Okay, and can you count from 20 to 1?
Yes, 20, 19, 16, 19, 14.
Okay, okay, I see. Do you um, so Mr. Jack, do you have any I think
Prime Minister.
yes, Mr. Jack. And
Continue, Hassan.
yes. So I uh, uh, okay.
Think you wanted to ask about the Prime Minister or something like that.
Primary,
Prime Minister.
like what?
No.
Who is the Prime Minister? I think you would like to ask about this question.
Okay. Who is the Prime Minister?
This, I think he's now is Johnson, Boris Johnson.
Okay. Do you know what's the date now?
I think it is Friday.
Okay, and what I need the date of the day.
20, 20, 20, 26 August.
Okay. Do you know which day we are?
What again? Sorry. Come again, please.
Ask your question again, Hassan.
حسن زي الطلع.
I think Hassan left the meeting. He have 1 minute.
يا قبل ما يجي يا مستر محمد.
أيوة.
وانا المفروض ازعل من الابريفيتد.
Yes.
Continue,
Mr.
Hassan.
Jack?
You have 40 ثانية. Okay.
Yes. Do you know which day we are? Which day we are?
Which day? It is I think Friday.
Okay. Do you know your address or where you live?
Yes, I'm living in 28 Western Rise.
Okay. Okay. Thank you, Mr. Jack, for your helping. I will discuss what we said with my consultant. I will come back with a response.
Okay, no
Could you
problem.
please present your case?
Okay, I am going to present Mr. Jack. He has a impairment, cognitive impairment symptoms with memory loss and decrease in recalling, and I think this is possible delirium, dementia.
So,
Okay.
what could be the cause of her dementia or delirium?
Okay, we can be infection, it can be electrolyte disturbance, it can be drug withdrawal, it can be due to
Okay.
it can be due to seizure, convulsion, brain or brain tumor.
Yeah, that's enough, doctor. And how you will manage this patient?
Okay, I will manage this patient after discussion with after doing full neurological examination and after discussion with multidisciplinary team and after taking investigation, I will monitor or I will do some I will follow the patient vitally and by GCS and blood pressure, pulse, capillary refill, urine input, output, and maintain maintain food nutrition and rule out other causes.
Okay. Do you like to consider any investigation before all that?
Yes, I will do full blood count to rule out infection and inflammatory marker to look and to look for hemoglobin if it's low. I will do electrolyte and RFT to rule out uremic encephalopathy and other and electrolyte disturbance, and I will do EEG and CT brain to rule out other brain disorder.
That's enough, doctor. Will you allow your patient to go for surgery and why?
No.
Time up or continue?
Yes. No, because lack of capacity until if it is urgent, I will take consent I4 after this patient interest with two consultant signature of consultant.
You said capacity. What do you mean by capacity?
Okay, because the patient cannot understand or cannot decide to do surgery or cannot know how
Yeah, I
to.
asked you about the definition and you answered it in another way, but you are right. So if if this were an emergency, would you allow surgery?
Yes, I will I will do surgery with patient interest, with consent I4 with two signature of consult.
Okay. And what is the mental state examination?
Skip this patient.
Okay. And how many points in this mental state examination?
Skip.
Okay. Can you name two paper-based capacity tests?
Skip.
Okay, I think we reached to the end of this station.
Yes, can I start, Muhammad? I just want to add.
Yeah.
So Hassan, I don't want to feel bad about this station at all. Obviously, because you weren't prepared, there's some point missing. But even though you managed to answer multiple questions and you managed to take through the station, Muhammad, what I want you to go through later, I want you to start from the beginning till the end. But the most important points, Hassan, you just need to
Yes.
introduce yourself. Hello, my name is Hassan. I'm one of the doctors working here. I came to assess your memory today. Are you okay with that? Yes. I will be asking you questions. Yes, are you okay to answer? Yes. Then uh, start with the patient name and age. Can you just tell me about your name and date of birth, or your name and your age? And then you follow the question by question by question. And when you come to the presentation, you should say, I assessed the memory of this patient present with symptom of cognitive impairment, including disorientation. You just say, like, I just took this lady and I assessed her memory. And you need to mention the AMTS score, abbreviated mental test scoring. How was it? How much was it? 2, 3, 4? Is the highest mark is 10 out of 10. And then there's some candidate who says the examiner asks them about the MMSE, mental state examination. So this, you need to know it. We have all the details written. You can just review the session later on. You need to review it later, ya Hassan. You need to read it from A to Z. But you still performed well. Like, even though you don't know the station, but you were able to answer a couple of questions. Okay?
Okay.
Yeah, Muhammad,
Yeah.
can you review the session from the start, please?
Yes, Hassan, very nice presentation. Even you didn't prepare well for this, but as Ali said, you managed it well. So Hassan, we have countable thing we asked during dementia. We have two system to measure dementia: abbreviated mental test score and mini-mental score examination. Usually we start by abbreviated mental test score. In many exam and recalls, you should start by AMT, then mini-mental score examination. So when you start by abbreviated mental test score, you should start by the countable thing, like what is the time, as you ask, what is the year, how old are you,
Yes.
what is the date of your birth, you know, this all about countable thing, right?
Yeah.
And can you count backward from 20 to 1 or 20 to 10 or 20 to 15, any numbers? Then you should separate this countable from non-countable by asking the patient, can you remember this address, 24 West Street? I will ask you this at the end. Then the next, when did the wide war end? Who the prime minister of this country? What's the name of this place? What's my job? What's the job of this person? And what was the address I asked you to remember later? Okay. We have two items. Separate between them by the street. The patient should remember it. Okay.
Okay.
And then the patient will, if you have a time, you should start asking about the mental score examination. As you did in this station, you didn't finish the abbreviated mental test score as you not prepare well for this station, but you ask some question of mental state examination as what is the date, what is the day, and so on. Regarding the mental score examination, we can do another session later on. For now,
Yes,
just master
yes,
for
we-
this abbreviated mental test score.
Yeah, we will do another because some students says they ask them about the mental test scoring. محمد, I need to leave. أنا قاعد مع عبود عامل لي حفلة والله.
يا
Okay,
علي،
this
علي
is the
قبل ما
last session.
تمشي، علي قبل ما
Yes,
تمشي في نفس الاستيشن ذاتها، انا بعد ما اخلص الابريفيتد منتال ستاتس منتال سكور ده